We all have our different fears, but the greatest of them all is hearing our loved one's last heartbeat.
Postmortem care is the care provided to a patient immediately after death. The nurse is responsible for many post-mortem duties, including final reporting, treatment, and final disposal of the body, and providing assistance to the family after a patient has been pronounced dead by the attending provider. There are guidelines that need to be done in order to perform proper caring for the deceased person. Members of the healthcare team should be knowledgeable about death and dying ethics, as well as attentive to the patient's and family's cultural tradition. In the face of death, maintaining the dignity of traditions and mourning activities gives families a sense of familiarity and control. The healthcare team members should provide a peaceful presentation of the patient for the individuals who desire an opportunity to grieve and view the patient. To avoid tissue injury or disfigurement, post-mortem treatment should be given as soon as possible. A consent document must be signed by the patient's legal representative as well as the doctor or appointed requester. If applicable, a clarification of the importance of autopsies in furthering medical knowledge may be required. The nurse verifies that the patient has been pronounced dead by the physician.
The nurse then will inform the family and the physician of the deceased person about the findings and finished documents. The nurse will ask if they have traditions or rituals that they usually do for their deceased loved ones before performing the care itself.
Give the family members their time to be with the deceased before performing the procedure.
A nurse will then inform the family about the procedures expected to be done by the nurse who will perform the caring. Ask them if whether or not would they want to witness the postmortem care being done or being performed by the nurse. It is important that the nurse will always inform the significant other on the procedure proper.
Here are the following materials or supplies needed in performing the procedure. PPE such as gloves, gown, mask, and eye protection. Plastic bag for hazardous waste disposal, wash basin, washcloths, warm water, bath towel. Clean gown or disposable gown for body as indicated by the organization's practice. Cotton to clog the areas where possible secretions occur, such as ears, eyes, and nose. Shroud kit with name tags for identification purposes. Scissors, small pillow or towel. Paper tape and gauze dressings, paper bag, plastic bag, or other suitable receptacle for patient's belongings to be returned to the family members. Valuables envelope, gauze, denture cup if needed.
Prepare all the equipments accordingly inside the room where the patient lies. It will save you time and effort. Draw the curtains. Make sure to provide privacy for the deceased person and the family members. Do a hand hygiene. Make sure to thoroughly wash your hands before doing the procedures. And put some gloves on. Loosen the patient's blanket. Remove all jewelries from the body and put it inside a plastic bag, which will be given to the family members after the care. If the patient's eyes are open, close it gently for you to pay respect for the deceased person's body. Wet the towel and wrap it around your hand to form a mitten. Clean the patient's face first. Gently rub the towel on the surface of the patient's face using a circular motion. Use a cotton to cover all the areas where usually secretions occur, such as the eyes, nose, and the ears. Using a clean scarf, tie the patient's head from the jaw up to the skull to keep the patient's jaw in place. Clean the upper extremities of the patient by gently rubbing the arms with wet towel. Cover the patient with a clean sheet and remove the used sheet from the patient's body. Then remove the patient's gown before cleaning the upper body. Clean the patient's skin thoroughly to avoid any infection or bacterial growth from the patient's skin. Move to the lower extremities of the patient. Using a wet towel, clean the foot, the upper leg, and the lower leg of the patient. Then cover the patient's body with a blanket over its head. Then put an ID tag to the patient's body. It is usually placed on the thumb of a foot of a patient. Its purpose is for a quick identification of the patient's body by the family or the funeral assistant.
Prepare the necessary paperwork for the body's removal. Call the funeral home and other personnel to assist with the body transport. Make a note about the personal artifacts that were released with the body and who received the other belongings as well. Nurses are there when the last breath is taken, and nurses are there when the first breath is given. Although it is more enjoyable to celebrate the birth, it is just as important to comfort in death.